Welcome to the CCO World CCO Lifestyle webinar. My name is Jean Morrison, Senior Product Manager with GC Orthodontics. It is my pleasure to introduce Dr. Antonino Secchi. This webinar will be the first of a series of 4 for 2025. Dr. Secchi maintains his private practice in the Devon, Pennsylvania area outside of Philadelphia. He is board certified, a member of the Angle Society, is well published throughout many journals, and he graduated from the University of Pennsylvania, where he held clinical associate professor and clinical associate director positions for over 10 years. Dr. Secchi is the founder of the Complete Clinical Orthodontic System, or CCO System, and provides continued education for orthodontists in the United States and throughout the world. He lives by his mantra, "We don't live to work, we work to live." He will share his insights on how to maintain a busy, successful practice while maintaining a fulfilled life with his wife and 5 beautiful children. Without further ado, I will pass it to Dr. Secchi.
Thank you, Jean, for that nice introduction. And thank you very much, GC, for giving me the opportunity to do this webinar series. I want to remind you that it's a series of webinars that start with this one as the first. So, dear friends and colleagues, whether you are watching this webinar or just listening to it, now it's time to relax, and I hope you guys will enjoy my sharing. Being in Philadelphia for so long, I can't help but remind you that the AAO this year, in just a couple of more months, is in Philadelphia. Beautiful city, a lot of history. I'm pretty sure if you come, you will have a great time. And I want to remind you that we are the football world champions. So I'm very happy. It's been a great year for us. I practice outside Philadelphia in Devon, orthodontics. Also, my family, I live 10 minutes from the office. I have 5 kids. You can see in those 2 pictures, we prefer to be outside in the outdoors rather than inside. I have 5, and they range from all the ages. I mean, I have out of college, in college, and still in middle school and elementary school. So I would like to share with you, because people ask me, how can you do that? How can you work, teach, have an office, have 5 kids, and still kind of be happy and have time for yourself? And the answer is, it's not easy. I mean, there has to be a work-life balance. There's no question about it. Everybody that I know, whether they live here or in other countries, they all want to be happy, and they all are working hard to get this balance. I can tell you that I've been a dentist for almost 30 years, orthodontist for over 22 decades, and raising 5 kids. I've been married for like 3 decades. And I'm trying to have time for myself too, to do what I like, sport, outdoors, etc. It's not easy, but it can be done. It can be done. So interestingly, how did I get into this kind of topic of work balance? And we're going to be talking also toward the end of the presentation about lifespan and health span. A few years ago, I was reviewing a paper for our Angle Society, and the paper was was about mental health of patients coming to our office. But reviewing that paper led me to review a lot of things about mental health, and I started researching about mental health in our profession, interestingly. So let me show you what I found really briefly, and almost like the 2 sides of the coin. So when you go and you search for dentistry and orthodontics, you can search these US News ranked best jobs in America. And consistently, if you go back to 10 years till today, I'm just showing you 2023, you will find out that always dentistry and orthodontics are ranked top 10, top 5, sometimes best jobs. The 10 best careers with the most job security. You can see there dentistry and orthodontics. So there's no question that we are in a great profession, specifically for you all practicing in the US. When it comes to income and money, you can say here the best paying jobs in 2023, orthodontics was ranked number 5. And that is not talking about owning your own practice like most of us do. That can increase substantially that. So there is no question that I would say money and wealth is not a problem, thank God, in our profession. But the other side of the coin, you start seeing some of the papers about mental health, health in general in our profession, and I included over there some key points that I want to mention to you. You can see that emotional illness ranks as third in frequency among dentists. Coronary disease and high blood pressure over 25% more than general population. Psychoneurotic disorders, 2.5 times more. Number one killer in dentistry is stress-related cardiovascular disease, and you go on and on. And I'm pretty sure you know, and unfortunately I know of colleagues, orthodontists and dentists, that they have basically killed themselves, which is not nice. And you go to meetings and you see your friends, and even though they're doing well, officers are doing well, they might not be as happy as you might like. So what's going on here? There's some answers that they have been researched over the years. Confinement, isolation, stress of perfection, that can kind of, many of you will relate to that. Time pressure, compromise, treatment frustration. How many times we've been there in orthodontics? Patient anxiety, and also dealing with patients in general, not only kids, but parents. It's not easy. Lack of exercise. Interesting. We will talk about that at some point later. Dentist personalities, compulsive attention to details, extreme consciousness, careful control to emotions. We have to be happy all day, even though we don't feel good. We need to kind of be smiling to everybody showing into the office, which is not easy. Unrealistic expectations, etc., etc. Marked dependence on individual performance and prestige. So, anyways, there's so many factors in our daily life, in our work, that make us being stressed. Mental health is an issue. If you put that to nutrition and etc., exercise, then you start seeing how sometimes things don't look the way that they should. So, mentally speaking, we need healthy doctors to treat sick patients. Are we reactive or proactive to some of these problems? And I can talk a lot about this because it's an area that I've been searching and reading a lot over the last few years. So, having said that, I would like to welcome all you to this series of webinars where we're going to be talking about work-life balance in orthodontics and unlocking this power of the CCO system. Today is the introduction. In the next few webinars, I'm going to be targeting specific areas, not only of the mechanics of CCO, but also about health span specifically, and how we can increase that and feel better. So interestingly, let's talk about orthodontics a little bit. So what do I see today in the world of orthodontics? Interestingly, I'm telling you, after so many years practicing, I've seen pretty much everything. But today, specifically, I see a lot of complexity for problems that they don't look that complex. A little open bite with the occlusal plane completely deviated, level and aligning, and you see cases like this treated with mini plates, etc., etc., and there is a big push for this type of mechanics. Things like this that I am quite frankly frightening publish, kind of intrude with that kind of inclination where you know that the roots will basically blown in the cortical bone, but you still see these things and even publish. You see things like this in social media with, we like it or not, many young orthodontists, and not that young, they're searching, they're looking to I mean, this is what you see every single day. Complex things that don't make sense to me. It's almost like a why we need to make it easy if we can make it difficult. Interestingly, so today I see an emphasis to push a variety of complex solutions to problems I don't have. Very interesting. A lot of difficult solutions to problems I don't have. So I think that we need to revisit this, and um, and I don't like to see the amount of technology we have these days, and I still see sometimes second opinions, cases that are refer cases from other places, and I see orthodontic mechanics from the 70s, the 80s, in 2025. And it doesn't matter if you have the latest scanner, if you have the latest CBCT, and the treatment plan is 3D, if by the time you put the appliances in the mouth, everything else is from the 80s, it doesn't make any sense to me. Um, we've been talking about this for years right now. So I came out with the CCO system more than 10 years ago, and the mantra was that have to simplify treatment mechanics for orthodontics. And maybe 10, 15 years ago, when I introduced this, maybe people were not ready for it. And there was a big push at that time for other things. People were talking about the technology 15 years ago, the scanners, the printers, etc. And interestingly, today, it looks like people are really, really wanted to hear more about this. So what is the CCO? It's a system that integrates an interactive appliance with a prescription based on finishing. And I'm going to explain that a little bit. With a set of sophisticated super elastic wires. Very important, very sophisticated. We will talk about that. And really important with a goal-oriented sequence. So we have protocols to treat these cases. So let me show you a couple of cases as an illustration before even we start dissecting this. So let's see, this young guy here comes to my office, can be your patient next morning. It's class 2 on the left side, class 1 on the right, midline deviation, deep bite. Nothing really crazy, but I like to emphasize the cases that we see every day. I don't want to spend a whole webinar on a case that you and I will see only one in a decade. I want to emphasize the cases that we see every day, because that's what we need to do. We need to be great in the 70-80% of the cases that we see every single day. So this particular kid, some crowding here. So we start first leveling and aligning with the appliance and a 014 super elastic arch wire. Then we go to another wire, it's the 2020 bioactive super elastic arch wire, and this is just leveling and aligning. We start with the lower jaw in this particular case. After the 2020 in the upper, we put a 014 in the lower super elastic. We get to the 2020 in the lower, and now I have basically the case level and aligned in these super elastic arch wires. And the next step is what we call the working stage, when we place coordinated upper and a lower stainless steel arch wires, 19 by 25 stainless steel, and we start with the mechanics of closing spaces right now, very simple with power chain, class 2 elastic as needed, typically 4 ounces. We can do the details. I put a little bit of reverse curve to level the occlusal plane, And I spend sometimes in this phase making sure everything is happening. We are leveling the occlusal plane, we're closing the spaces, the wires are providing and expressing the tip, the torque, the offset, etc., built into the prescription until we get to the very end, settling the occlusion, and we take the braces off. Now, this is basically a common case. The interesting thing about this case, and the ones that I will show you, is that as you can see in the following slide, this case was treated in 14 months, 11 visits. But most important than all that is the time that the case really spent in my office, in the chair, 4 hours. And that's how we start talking about the time, because it really doesn't matter for your overhead or your office how long in months the case took. Really what it matters is how much time that case kind of spend in your chair time. So right now what we do is we measure that since the day that we place the braces until we debond the cases, appointment by appointment, visit by visit, and we see how much time the case spent in our office. And 4 hours is not bad. When I graduated 20 years ago or more from the University of Pennsylvania, I still remember we used to see cases in the graduate program every 4 weeks for half an hour for 2 years. So if you start putting all that time, you're gonna end up kind of every case was like a 12 to 14 hours. Now we're talking about 4 hours. Just for you, when I made the note, just in case the numbers don't tell you the whole story. Now let's see this other case here. Another young girl, another case that can be your everyday case. Crossbar in the front, a little bit more crowded. This case had an expander, and after the expander, I put the braces on. Upper and lower together, I open the bar in the back with some build-ups, and I start the case with a 014 super elastic initial oil wire. I typically at this point in the mechanics, I see the intervals about 8 to 10 weeks, and comes back. We put the 2020 bioactive upper and lower. That's simple as that. I mean, change the wires. How long can that take? Makes it 5-7 minutes. Then we place the 19 by 25 coordinated arch wires, and we start with the mechanics, closing the spaces. If you need to do some rubber bands, you can do it. The case basically goes to settling the occlusion, closing all the spaces, and we take the braces off. You can see this case, the smile, and this case was treated in 13 months, 7 visits, 3.2 hours, short time. So our protocol for most of the cases that we treat is basically dividing the mechanics in 3 stages, very simple: leveling, aligning, working stage, finishing stage. For most of the cases, there's no round tripping. It's from one stage to the next. And we have defined goals at each stage, and we have a wire sequence that we use. And that is known by you, and it's known by your staff. They know this by heart. I don't even have to tell them what's next because they know which wire they're going to have to use. They read the chart and it's all there. And it's very, very predictable and it's consistent. So it's rather efficient and easy for your practice and for your staff. So movements that we achieve. In leveling and aligning, we achieve all the leveling and aligning, correcting the rotations, tipping. We start leveling and aligning. Working stage, we level the occlusal planes, we coordinate the arches, consolidate the spaces, etc. And then in the last stage, we just fine-tune to position and improve the intercuspation. Most of this is done just by the wires and the appliance. Power chains, rubber bands, nothing out of the ordinary, nothing fancy, but we have really good wires and a support bracket that we know how to use it, and we put those to the task. Wires. There is some few that you can choose. For the last few years, if not a decade, I've been literally using 3-arch wires for most of the cases. A 014 initial oil. I go to the 2020 bioactive to finish my leveling and aligning. That correct in the bracket that we have. Most of the rotations, if not all, and then we can go to the 19 by 25 stainless steel without any problems, and that basically help us to level the occlusal plane, provide the right torque, etc. And then for finishing, we can go back to the 2020 bioactive just to settle the bite if you need to settle the bite with a softer wire than a 19 by 25 stainless steel. Sometimes you don't have to. So interestingly, many cases can be done with only 3-arch wires. Now, I will show you later, not in this webinar, other cases more complex that maybe we need to use an extra wire. But before we get to those cases that I told you that we don't see very often, I want to show you the cases that we do see every often, and the cases that they should be basically complete in an efficient way. So talking about wires, the wires that we use are very sophisticated, and there's a lot of technology that we don't pay attention to it. We've been so bombarded by the technology, digital technology, in different forms that we forget about the technology that we have in these appliances and wires. Just to give you an example, look at this table. I mean, I'm not an engineer, but when you see those graphs, the curvature of deflection and force of these wires is absolutely impressive. So when people ask me, how can you put a 014 and engage every single tooth, even though those canines are so high or they're so rotated or etc. When you see the 014 graph over there, you can see that it doesn't matter really how much you deflect the wire. The force that is providing once you release the wire is almost the same through the whole movement. Very impressive. And we can talk more about that, but it's very important to emphasize that that it's not just a bracket, it's not just the wires, it's the combination of it. And unfortunately, not all are the same. So these are very impressive arch wires that we use specifically when we level and align the case. That's why we have a system that is interactive, can be passive at some stages, and can be active based on how the arch wire interact with the slot or with the clip, and based on time and movements. Interbracket distances start decreasing as you level and align because the brackets can slide through the wire or the wire can slide through the bracket. And that's how we see cases like this, and the arch wire will just go back to its original form, and the reciprocal forces and the ability of sliding that you have in these appliances and wires will make the alignment to be very, very simple. That's why we can start like the case that I show you like this, and in 8-10 weeks, the patient can come back like that. And you have pretty much the leveling and aligning solved in 1 or 2 appointments. And we have a bracket that the geometry of the slot and the clip and the way that the clip is manufactured is providing optimal torque as you increase the size of the wire, the protrusion of the wire. You don't have to fill the slot in these appliances. You need a clip that has to be strong, memory, and provide control. And we know over the years, because it's been studied more than a decade ago, that on a 19 by 25 stainless steel, this specific appliance provide a great amount of expression, basically torque-wise. And that's why we emphasize leveling the occlusal plane, because by leveling the occlusal plane, you have the incisors that are very important with the inclination that you like, with a very constant inclination that support the lips and help you to have a good intercuspation. So, and that inclination can be whether you start with flare-out teeth, like in this case that I treated years ago, before and after. You can see the X-ray here, before and after, and you can see the template that we have for the inclination of the upper and lower incisors is almost the same as in this case, which is completely the opposite. A deep bite with a lack of torque, but after we level and align the occlusal plane, in this very, very deep bite case, what I could say brachiocephalic deep bite case, when you see the incisors, they're all basically about the same inclination at the end. So it gives you reproducibility, and basically you have the confidence that those incisors will be where they should be by the end of the leveling and aligning and the occlusal plane. Now, prescriptions, interesting. I mean, most of the twin brackets over the years, the Andrews, Roth, MBT were done based on a different type of mechanics on twin brackets. In 2012, I developed the CCO system, and we had a prescription that it was basically based on this interaction of the wires and the bracket. So we kind of fine-tuned the numbers, and we've been using this in many places, including the US and abroad, for more than a decade, very successfully. Important is to notice that it doesn't have some of the overcorrections that other prescriptions have based on the mechanics. So that's why the finishing is easy, because many of the mechanics, and I don't want to get deep into this, the prescriptions had a lot of overcorrection to help you leveling and aligning without losing anchorage. Right now, for many reasons, we don't have those problems that I can explain you maybe on another time. So anchorage is not a problem for this type of mechanics that we do. So we don't have to have those overcorrections, and we can emphasize the prescription on the finishing, where those teeth should be, how they should look toward the end. And the straight wire appliance has definitely proof it works over more than 5 decades now. It has simplified how people do things, and still today is tremendously relevant, and allow us to treat the vast majority of our cases with just one appliance. Maybe fine-tuning a couple of things here and there, but it's really efficient in that regard. Bracket placement is important. Indirect bonding is something that I emphasize. I use indirect bonding under direct bonding. Indirect bonding I've been using dips. It works extremely well, and it's very important also to emphasize the leveling of the occlusal plane. We have a webinar just devoted to these topics because it's extremely important and can save you a lot of stress and time to understand the implications of leveling the occlusal plane in solving some of the malocclusions. And of course, the concept of the CCO coordinated arch wires, why we coordinate them, how we coordinate them, and basically the concept of providing the anterior and posterior overjet in the wires so they can basically translate that to the teeth. Very important concept. So when you put everything together, you have really a powerhouse system that can help you a lot and simplify most of the mechanics that you do in your office. No question about that. In the last few years, technology has impacted our office tremendously. CBCT, scanners, indirect bonding. So we over the last few years have spent a lot of time seeing how that technology can help us in treatment planning, in records taking, etc. I think, guys, it's time to go back to the basis and see how we can really improve the delivery of our treatment share side. What can we do inside of the mouth of those people So our mechanics will be kind of more 2025 and not 1980s. I think it's time to go back to that and start working heavily on it. And that's why I'm so excited about what we do. So let me show you a couple of more cases here before we finish this session. So these girls are a little more crowded, as you can see in the lower jaw. I could say moderate crowding, sometimes severe. And I decided for many reasons to treat it without extractions. You can see here we start leveling again with an 014 initial oil wire. I put a little initial oil coil to start on the 014, opening the space a little bit more for the canines. Then I decided to start working on the lower arch. I opened the bite a little bit so she's not biting on the braces. We put a 014 and we engage every single tooth. Remember, it doesn't matter how deflected is the wire, the amount of force delivering is exactly the same as if the crowding were almost non-existent. So look at how the case is right now and how it's in another 8 weeks. And we go little by little, expressing the wires, upper 2020. Now we are in the lower 2020 bioactive. And then basically it's been just changing the wire so far. Now I put a 19 by 25 stainless steel, upper and lower. Remember, coordinated. We ran some rubber bands, and then we start closing the spaces with power chain. And in this case, I ran a little bit of a class 2 and triangular elastics, specifically on the left side, as you can see right there. And we finish the case. So this case was finished. You can see there the smile, and it was 4 hours 5 minutes short time. And then let me show you another case. This case was an extraction case. So this kid, I decided to send him to remove the upper and lower second premolar, so upper and lower 5. The case came back 1 week after the extractions to the office. That's the x-ray before the extractions. Just wanted to make sure that you see that he had premolars before. Yep. And then came back to the office, and we start with an 014 initial oil and the CCO. Let it go for 8 to 10 weeks. Come back, ready for the 2020 bioactive, another 8 to 10 weeks. And then he was ready for the 19 by 25. The spaces they close a little bit just by leveling and aligning. That is what we call passive space closure due to the crowding. And then I decided to just start closing the remaining spaces with power chains and run some short class 2 elastics, upper 3, lower 5. And toward the end, the triangular settling the bite, upper 3, upper 4, lower 4. Keeping the occlusal plane level until we take the braces off. So in this case, as you can see right here, was successfully treated in a very simple way. And the case, here's the x-ray after treatment. And was 3.7 hours short time, this case. So my question to all of you is, what do you want? Do you want to learn complex mechanics that you will never use, that actually you don't really need? Time consuming. Time means money, so increase your overhead. Stressful. If you can please, if you understand what is going on in these two pictures, please text me, because I still can't figure it out. What stage is that? Leveling, aligning, working? I have no idea. Why we need to do this today? There's no reason for. Today we can have most of the cases treated in a very simplistic way, but very consistent, with a lot of efficiency, and as you could see, with quality. There's no question about it. That can save time, be more profitable, absolutely, and reduce tremendous amount of stress in your office for you and your staff. So having said that, um, talking about balance between work and life, and there's one word that is being very, very, I could say, is on vogue, on fashion right now, is longevity. I don't know if because of this documentary that I don't know if you've seen it, is on Netflix, Live to 100, the Blue Zones. You should watch this. It's very interesting. But I've been very interested in longevity. I mean, I think that you don't think much about that when you're in school, when you're 20, 30 years old. But as you get older, in my case, 50, and you start thinking about it. And I wish I had known years ago what I know now about lifespan, health span, etc. Because the sooner you start taking care of yourself, the better. So this brings the point of understanding what is lifespan and health span. Lifespan is how much you live, and there's no question about that. That has increased over the last 100 years for at least us in the Western society. But health span hasn't increased very much. So we live longer, but the last few years of our life are not better, and they're not better. So modern medicine is keeping us alive, but not in a very good shape. So we need to do something about that, and that's how work-life balance is very important. So what can we do to increase not only our lifespan but also our health span? Specifically, as dentists, orthodontists, and we have a lot of stress in our life just by the way that we work, micro stress. Families, kids, I mean, you name it. It's not easy, the life in 2025, as you know. So there are four major areas that we can do something to improve the way that we live. One is nutrition, exercise, mental health, and sleep. And of course, I can talk. And I'm not an expert, but I can talk a lot about these things. I've been reading a lot, and we're gonna be talking about in the next webinars more and more about these things. What can we do? How can we improve? Little tips, little things. Maybe share some of my experiences about nutrition, exercise, mental health, and sleep. Um, One thing that we need to understand is the most important part of all this is you. You are the one who has to feel good. You are the one who has to be healthy. You are the one healthy mentally and physically to be able to provide to the ones you love, your family, to your office, your patients, your community, society. So this is important. So we need to think about that. I know that this is a very important area for everybody, young people, that they see the world different than maybe us or maybe our kind of professors. But it is important to understand this, and there are many things that you can do to take care of yourself and therefore take care of the ones that you love. And we have to have some knowledge, some discipline, and action. So we need to move and do things that we have to improve the way that we live, our nutrition, exercise, mental health, and sleep. And we're going to be talking about that. There's a lot of knowledge out there, but we need to have a filter for it. And I hope and we can talk in the next webinars more about that. And that's my plan. So I hope you enjoy, and I made you think about this. You can have a balance life work life balance, but you have to have the knowledge, and you have to do the action to do it. So, dear friends and colleagues, thank you very much for this time. Now we're gonna kind of finish the presentation, and I'll be more than happy to answer questions that you might have, any kind of questions. So thank you again to all of you for the time.